The Monterey County Prescribe Safe Initiative is a 17-organization collaborative whose aim is to reduce the misuse, abuse, and diversion of controlled prescription medications. Every day, our ED physicians and ambulatory care physicians are seeing patients that are coming in with signs that they're misusing, abusing, or potentially diverting medications for sale out into our community to our children.
I like to think of Prescribe Safe as having a number of different ways that it improves the health and safety of our community. So one thing that we're working on with Prescribe Safe is to decrease the amount of pills that are prescribed by your physician. So when you go in for an ankle injury, you don't get 40 Norco. There's something safer, and so we're educating our doctors on that. Another thing is we're educating our prescribers and our public on alternatives for pain control. We want to treat pain. That's critical. We have to treat pain, but we're trying to find safer and better ways to do it. In addition, we're trying to get medications when they're not needed, any medication, not just opiates or other medications that are controlled substances, but all medications that are really unsafe when they're not being used or no longer needed, we're getting them out of circulation. And then other things we're doing is there are patients that are addicted. There are approximately 4,000 opiate-addicted patients in Monterey County. And so we're trying to help them with services, trying to get them into rehab, trying to get them into medication-assisted treatment, because then they can get their lives back and rejoin society being treated for their chronic disease of addiction. So if you want to know who it's helping, I can't think of anybody it's not helping. If you look at yourself as a patient, if you look at yourself as a family member, or as a parent, or as a person that's suffering from the disease of addiction, everybody is impacted by what we do in Prescribe Safe.
In Monterey County, obesity and type 2 diabetes are becoming a huge problem. In fact, 4 of the 5 major healthcare concerns in Monterey County are linked to diabetes. The goal of the Diabetes Initiative is to decrease the incidence of obesity and type 2 diabetes in Monterey County. The educational part of this is key because I think the public looks to the medical community to come up with fancy new antibiotics and procedures to cure them. But this one's really simple. It's exercise more and eat more oatmeal. But if people don't know how to do that, and if all their parents ever cooked for them was tri-tip and baked potatoes, they don't know where to start. The facet of the program that I think is most important is that the pediatric wellness coach actually comes to the pediatrician's office. So I can see a patient who I identify as being at risk for being overweight and thus developing type 2 diabetes. They can book an appointment, a half-hour slot in our office with the pediatric wellness coach who can meet with them individually. And then they can have follow-up appointments with that coach, and in addition they can sign up for supermarket tours and group meetings as well. Donations to the program go towards supporting the Diabetes Initiative program, as well as the salary of the pediatric wellness coach who's been hired. I think it's a wonderful program because it brings together something that's county-wide. It's nice to see that CHOMP and SVMH working together to improve the health of those in the county.
The Montage Health Mobile Health Clinic is here to serve the homeless in our community. We're bringing health and connection to our homeless population.
Our goal is to serve our community that has trouble with access to care, provide basic primary care like blood pressure management, diabetes management, and also simple urgent care as well. respiratory infections, minor skin infections, bladder infections, ear and eye conditions. We really can do a lot in a mobile setting.
The bus is going to be staffed with volunteer emergency department staff. We're going to have social workers. We're going to have an intake person. So when a patient comes to be seen by and served by the bus, we'll start with registration, and then we have a lovely waiting room here on the bus. And we have ER techs to do vital signs. We have registered nurses to help triage. And then the patient will be seen by myself, a nurse practitioner, or by a physician.
The Montage Health Mobile Clinic is entirely dependent on philanthropy. So funds that come to the mobile clinic will go to running the mobile clinic, paying for medications, paying for bandages, driving the bus, parking the bus, really everything. So we are very grateful for any funds that are donated, because that's what's going to keep us going.
I'm excited for the services that we'll be able to offer. Basic health care. We'll be able to have social workers with us to connect people for insurance and shelters, food banks. I'm really excited about what this bus has to offer our community.